Assalamu alaikum. Bismillahir Rahmanir Rahim. I am Dr. Muhammad Jamshed. I will give you a lecture of general anatomy on the imaging techniques. So, first of all, we should know the objectives of the imaging techniques. So, the objectives are to describe the commonly used radiographs, and second, we should know about the various views used for obtaining the radiographs. So, imaging techniques are the techniques in which we do various methods for taking the images and visual screening display of internal features of the body, and these imaging tools let doctors see inside your body to get a picture of your those structures which are not visible, like bones, organs of the body, like brain, kidneys, liver, muscles, and the blood vessels and nerves. The techniques can further be classified into major two parts. One part of the imaging technique is the images in which ionizing radiations or X-rays are used. So it consists of simple radiography, and second, we have a computerized tomography scanning, that is the CT scanning. In these two procedures, ionizing radiations are used for taking the images, and so are they have hazards on the health of the individual. Other techniques of imaging is the ultrasonography, that is commonly called ultrasound, and the second one is the magnetic resonance imaging. In these two procedures, no hazards of the radiations are present. Radiological procedures, we have a plain X-rays or plain radiograph, contrast radiograph, and fluoroscopy. In plain radiography, we do not use any sort of the contrast media, while in contrast radiography, we use the contrast media, and then we take the images of the structure or the organ. And third one is the fluoroscopy. So in X-rays radiography, carried out by a radiographic machine, commonly called the X-ray machine, uh, which consists of various parts, and the X-rays passes through an X-rays beam is passed through part of the body to be examined and the image is taken. Sorry. X-rays are kind of electromagnetic waves which are used extensively in medicine for both diagnostic and therapeutic purposes. Diagnostic purposes, like we take X-ray for suspected chest diseases, X-ray chests are taken, and similarly the intestinal diseases like obstruction, we take the radiographs of the abdomen in various positions, like standing position or erect posture, to know about the intestinal obstruction. And therapeutic purposes, these X-rays are used for the treatment of the cancer. The materials that absorb less X-rays are referred as radiolucent because the rays can easily penetrate these structures. Like lungs and intestine, they cause most blackening of the radiographs. And second thing is that the materials that absorb more X-rays are referred as radio opaque. Radio opaque, they can hardly be penetrated by these X-rays, like the bones, which are very visible, and they look radio opaque. And similarly, the foreign body, metallic bodies, which are sometimes accidentally uh, enter the body, they can be seen radio opaque by taking the radiographs of the part where they are present. This is the image of X-rays machine or radiographic machine. So the next image, we can see that this is the X-ray machine, and this is the patient to be X-rayed, and it has a distance of about 72 inches from each other. And this is the X-ray machine, this is the patient or the person, and this is the film plate where the X-ray film is placed, and the beam of rays passes from behind. And here, when they enter this film plate, here is a film. So the X-rays of this patient, they are taken. This is another projectional radiography in which this is the X-ray machine. The patient is lying on the table, X-rays table, and this is the side from the film plate, and the X-rays film is placed here, like if this person is having fracture of the forearm, so it lays on the bed or on the X-rays table, and the beam of rays passes from the machine or from the tube, X-ray tube, and image is taken here on the this film. What we do in the contrast uh, radiography. The radiography which we discussed was a simple X-ray in which no contrast media was used for taking the images of the part or organ of the body. In radiography, which is done after introducing the contrast media in the lumen of organ or injecting in the blood vessel, is called the contrast radiography. The radiopaque compounds commonly used before taking these X-rays films are the barium sulfate suspension in water for GIT radiography, the aqueous solutions of appropriate iodine compounds for urinary tract and biliary passages, and cardiovascular for the cardiovascular system. Examples of the contrast radiography are the uh, in GIT we do the barium swallow. A barium sulfate suspension is swallowed by the patient, and after swallowing or during swallowing we take the X-rays, and the structure can easily be visualized after taking the X-rays. What we do in case of the urinary tract or biliary passages and vascular systems, for urinary tract and biliary passage, a dye is injected uh, in the vessel, and then the X-rays are taken. So this contrast medium reaches the structures we want uh, to be examined. And example is the IVP. In IVP, intravenous pyelography, the kidneys, ureter, and urinary bladder are examined. And cholecystography, similar after similar injection of the contrast media, we take the radiographs of the gall bladder and the ducts. Angiography, commonly used, a dye is injected into the blood vessel, and after that, uh, radiographs are taken. So they are then examined for having any pathology. This is the example of the contrast media of the GI tract. This is the stomach. The patient has swallowed the contrast media, and after swallowing, this dye is filling the stomach, and looking at the film of this patient, we can see the pathology, any obstruction or any filling defects in the stomach. Similarly, it is the barium enema. And barium enema from the rectum or enema is of the contrast media is given. So after giving this, various X-rays are taken, and this X-rays show this is the contrast media, and the radiographs shows any pathology in this intestine. What is fluoroscopy? In fluoroscopy, it is an imaging technique that uses X-rays to obtain real-time moving images of the interior of an object or organs like lungs, stomach, and intestine. The fluoroscopic image is visualized directly on the fluorescent screen. The sharpness of the image is inferior to that of the radiographs, which we commonly use. This is a fluoroscopic procedure. The patient is lying on this table, and these X-rays are taken and they are visualized on this display screen. So, what are the radiographic views? Radiographic views means, sorry, the view expresses the direction of the flow of the X-rays. By radiographic views, we mean that the view expresses the direction of the flow of the X-rays. The part of the body facing the X-ray plate casts a sharper shadow than the part facing X-ray tube. PA view, that is posterior anterior view. Here the beam of X-rays passes from the posterior to the anterior surface and the anterior surface faces the X-rays plate. Chest radiographs are usually taken in the posterior anterior view. Look at this image. Here is the X-ray machine, X-ray tube. The beam of X-rays passes from the behind or posterior aspect of the patient, and here the film plate is on the anterior aspect of the patient, and this view is also called the anterior view, as uh, mm, as I discussed that the image which is formed near the film plate is sharp than the image which is uh, formed away from the aspect of the person. This is the posterior anterior view X-ray of the chest. That is the posterior anterior view, or another name of this view is also called the anterior view. AP view. This is another view of radiography that is called the anterior posterior view. Here the X-rays passes from the anterior view to the posterior surface, and the posterior surface faces the X-ray plate. AP view is preferred for visualizing the thoracic spine. So let's see, this is the X-ray machine. The patient is lying on the X-ray table. Here the X-rays are passing from anterior surface of the patient, and the film plate is on its posterior aspect. So this is called anterior posterior because the X-rays they are coming from the anterior view of the patient, and the image is taken posteriorly. And this part which is close, the posterior aspect of the patient is close to the film plate. So here the image when formed is sharper. This view is most commonly used for visualizing the spine, as in this view the spine is very close to the film plate and the images which is taken is sharp as compared to the posterior anterior view. So we discussed the posterior anterior view, in which the beam of X-rays passes behind the body and the film plate is in front of the patient. While in case of anterior posterior view, we should know that here the beams of rays passes from the front of the patient and to the plate is the film plate is lying on the posterior aspect of the patient. Sorry. These two views are mentioned here. The left one is the posterior anterior chest view because the X-rays tube or X-rays were behind the patient. The patient was in standing position and the X-ray plate was in front of the patient. So the rays were coming from posterior aspect and the plate was on anterior aspect, and this is called the posterior anterior aspect. In anterior posterior, Chest X-rays. This is commonly taken in children as they do not cooperate to stand. And in this AP chest, the patient usually lies on the X-ray table. The X, the X-ray tube and are in interior aspect of the patient. They pass through the body, and the X-rays plate is on the posterior aspect. So this is called the anterior posterior chest X-ray. Right lateral view. When right surface of the body faces the plate, you should know that when we take the X-ray, so the part of the body or the structure which we for which we take the X-rays, they usually they lie between the plate, film plates, and the X-ray machine. So here, the right surface of the body faces the plate. It means that in a right lateral view, we place the plate on the right side of the patient, and the X-rays they pass through the body from the left side of the person. Similarly, in the left lateral view, when left surface of the body faces the plate, it means the plate is placed on the left surface or left side of the structure, and the beam of the rays from the tube of the X-ray machine passes from the right side, and between the beam of between the tube of the X-ray and the film plate, the structure or the person is lying. So this is called the left lateral view X-rays or radiographs of the part. This is the example of the chest that is in the left in the lateral view, and these are the bones which are also show the X-rays which are taken in the lateral position, maybe either in the left lateral, left lateral or the right lateral. Then comes the ultrasonography. Ultrasonography is an imaging test that causes sound waves, not X-rays, but they uses sound waves to create a picture. This is also called sonogram, and the machine is called ultrasound machine. And the pictures of various organs, tissues, and other structures inside the body are taken. It is used to create an image of internal body structures like tendons, muscles, joints, blood vessels, and internal organs. Its aim is often to find a source of a disease or to exclude pathology in the body. This is the ultrasound machine, and this shows the images of internal structures which are taken by this ultrasound machine. Then comes the computerized tomography, CT scan. In CT scan, magnetic radiations are used like the X-rays. A CT scan is a medical imaging technique that uses computer processed combination of multiple X-rays. Measurements taken from different angles to produce tomographic images of the body. allowing the user to see inside the body non-invasively. It helps in diagnosis of the exact location and size of the tumors, hemorrhages in the body, infarctions, in malformations like hydrocephalus. It provides images in axial and or transverse plane. In 3D CT scan, 3D cross-sectional pictures of the body parts are taken. CT scan can be done with or without contrast media. HRCT scan or high resolution CT scan is used for lungs parenchymal assessment in COVID infection. This image shows the CT scan machine. These are the various images taken by CT scan of the skull. And these are taken only in the transverse or axial plane. The next imaging technique is the magnetic resonance imaging or MRI. MRI, like ultrasound, is a safe imaging technique because in magnetic resonance imaging, the radio waves are used to generate images of the organs in the body. MRI is a medical imaging technique used in radiology to form pictures of anatomy and the physiological processes of the body. MRI scanners use strong magnetic fields, magnetic field gradients, and radio waves to generate images of the organs in the body. In addition to axial images, it produces images in sagittal and coronal planes. This is the MRI can be done with or without the contrast media. This is the MRI machine. These are the various images taken. These are in the axial uh, plane. These X-rays are taken in the sagittal plane, and these two images are taken in the coronal plane. So in MRI, we can do the images in the three planes of a structure. The other imaging techniques to peer directly into the body, a tubal instrument is inserted into the body openings, usually called endoscope, and the structure is visualized. What we do in this imaging technique, that a tubal structure visible with visible two ends, it is introduced through an opening in the body, and the interior of the organ is visualized, and such of type of the procedure is called endoscopy. There are various endoscopes which are used for the diagnostic purposes. and for taking the biopsies of the various organs and for removal of the uh, foreign bodies. The one is called gastroscope, and gastroscope we use it for esophagus, stomach, and small intestine. Another one is the colonoscope. With the help of colonoscope, we can do colonoscopy and for examination of the rectum and the colon. In cystoscopy, we visualize the urethra and the urinary bladder. Bronchoscopy is another instrument in which the trachea and the bronchi are visualized, and here again we can remove a foreign body, usually in children, inhaled foreign bodies. They are removed with the help of this bronchoscope. Laparoscopy is another procedure in which a laparoscope is inserted in the abdominal cavity or peritoneal cavity by making a small incision in its wall. Thank you.